Good morning, good afternoon, good evening, and welcome to my YouTube channel, Global Healthy Living. Before you continue, please subscribe to my channel and invite as many friends as possible to this channel because I teach you a lot of things concerning your health. Things that can help you to prevent diseases and things that can help you to improve your health. Today I'm going to talk about stroke. What is a stroke? Stroke is a serious life-threatening medical condition that happens when blood supply to the brain is cut off. Stroke is a medical emergency and so it needs an urgent treatment. So if you experience or if your relative experiences stroke, please contact emergency. Call ambulance immediately. So what causes stroke? Stroke is caused by two things. One, stroke happens when blood supply is stopped due to blood clots. The second cause of stroke is that stroke happens when a weakened blood vessel supplying to the brain bursts. So then stroke happens. There are many symptoms of stroke, but it's very vital for you to know that these symptoms happen suddenly. They don't warn, they just happen abruptly. So, one of the symptoms of stroke is numbness or weakness of one side of the body. A person who gets stroke happens to experience numbness and weakness that happens only on one side of that person's body. It can be in the face, it can be on your arms, it can be in the legs. So that's what stroke does. The second symptom of stroke is confusion, difficulty speaking, and difficult in comprehending others. A person who gets a stroke happens to have a lot of confusion, a lot of hard time to understand others. So that's what stroke does. The third symptom of stroke is imbalance and loss of coordination. So if a person gets a stroke, they tend to lose balance and coordination. Another symptom of stroke is intense headache. Stroke causes one to feel intense headache. The last but not least is changes in the vision. A person with a stroke tends to have vision problems. So, who is at risk of getting stroke? There are medical conditions that puts one at a higher risk of getting stroke. For instance, if you have high blood pressure or hypertension, you happen to have a higher risk of getting stroke. Secondly, if you have high cholesterol levels, then you are at a very high risk of getting stroke. If you also have diabetes, you also have a high risk of getting stroke. Last but not least, if you have irregular heartbeats, or call them atrial fibrillation, you also have a high risk of getting stroke. Even though stroke is a very serious medical condition, we have things one can do to reduce on the risk of getting stroke. Like for instance, eating a healthy diet helps you to reduce the risk of getting stroke. Secondly is reducing alcohol intake. Please, if you take alcohol, do not exceed the recommended guidelines that are 14 units a week. Do not exceed that. Then, by doing so, you reduce the risk of getting stroke. Also, stop smoking. If you stop smoking, then you reduce the risk of getting stroke. Thank you so much for watching this video, and please subscribe to my channel, invite your friend, share this video, and comment, like, and tell others about stroke. Share this information. By doing so, you save somebody's life out there. Thank you so much.